Chapter 36, treatment of atopic dermatitis and psoriasis. So we'll skip over the key terms as we'll go over them in the chapter. Eczema is a general term used to describe several types of inflammation of the skin. Atopic refers to a group of diseases in which there is an inherited tendency to develop other allergic conditions. Atopic dermatitis is the most common form of eczema. It is a chronic disease of the skin that often develops in infancy and may continue throughout adulthood. It is a forerunner to asthma and food allergies. Up to 40% of individuals that have eczema, atopic dermatitis also have allergies, asthma, and food allergies. So I fit into all of those 5 things: eczema, allergies, asthma, and food allergies. So, and so does my niece and nephew. So it's very common and it does run in families. Unlike contact dermatitis, inflammation of the skin, in which symptoms appear after exposure to an allergen, the cause of atopic dermatitis is unknown. Atopic dermatitis is characterized by autoimmune mediated inflammatory response that produces abnormal changes in epidermal skin cells and a hyperactive dermal response to irritants. Psoriasis is another autoimmune chronic inflammatory condition of the skin. It is a condition associated with a rapid turnover of skin cells, whereas the normal rate is usually about 30 days. This one can be short as 3 to 4 days with people that have psoriasis. And then I missed box 36.1, but that is common irritants for eczema. Atopic dermatitis. Atopic dermatitis commonly produces symptoms of intense itching, redness, skin irritation, and inflammation. Patches may form that are flaky and crusty and may even ooze a clear fluid. Individuals with psoriasis have thick, silvery, scaly patches. This is the most common type, known as plaque psoriasis. They may also have some redness and swelling, and itchy psoriatic patches may be found on the neck, elbows, genitals, scalp, hands, and feet. Box 36.2 lists signs and symptoms of eczema. Figure 36.1 is a child that has eczema on the face, and that is the infantile phase. And B is a childhood phase. Non-pharmaceutical treatment for atopic dermatitis and other forms of eczema involves using skincare regimens that reduce irritation as well as avoiding allergens and known irritants. Non-pharmaceutical treatment of psoriasis may also include the use of phototherapy, which involves exposing the skin to ultraviolet, UVA, or UVB light waves. It may be used alone or in combination with drug therapy. Phototherapy is only recommended for those older than 12 years. Adverse reaction to the use of UV light therapy are premature aging of the skin and increased risk for skin cancer. Recommended skin care for persons with eczema: we should avoid hot baths or showers, and air dry or gently pat skin dry after bathing. And we should avoid vigorous rubbing. The use of topical agents is a first-line strategy for the treatment of atopic dermatitis, psoriasis, seborrhea, and other inflammatory skin conditions. Absorption of drugs across psoriatic skin is poor because thick, scaly plaques and dry skin reduce penetration of topically applied drugs. This may limit the effect of topical treatments. The use of topical corticosteroids continues to be a mainstay of therapy for the treatment of atopic dermatitis and psoriasis. The use of oral corticosteroids is reserved for severe symptoms. Topical corticosteroids are categorized into 7 groups based on potency. And we will go down that box and read them from here. Class 1 is super high potency, clobetasol and diflurazone. Class 2, super potent, betamethasone, dipropionate, halobetasol, propionate. Class 3, very potent, amsinide, dexamethasone, halcinide, fluocinolone, mometazone, difluorazone, and triamcinolone. Then we have class 4, betamethasone dipropionate, the regular vehicle. We have mometazone furoate, fluoroandronolide ointment, and we have class 5, medium potency, beclomethasone, hydrocortisone valerate, hydrocortisone butyrate, fluticasone propionate cream. For the class 6, we have mild potency like desinide, prednicarbate, alclometazone. And then for class 7, we have the mildest potency like dexamethasone and hydrocortisone base. So number 1 is going to be the highest potency, and number 7 is going to be the mildest. Topical corticosteroids possess anti-inflammatory and immunosuppressive properties and produce vasoconstriction. Long-term use of topical corticosteroids can result in thinning of the skin, stretch marks, spider veins, acne, milia, rosacea, bruising, atrophy, lacerations, and poor wound healing when applied topically. Adverse reactions are more extensive when high potency corticosteroids are used and they are applied to a large body surface area. So we have all the topical corticosteroids, not all of them, but we have some listed here and all of their different dosage forms and strengths. So you can see some of them have quite a few: lotion, gel, cream, ointment spray for betamethasone dipropionate. For clobetasol propionate, we have cream, we have Olox E, foam, gel, lotion, ointment, shampoo, sprays, and solutions. So you can see quite a few of these have quite a few different dosage formulations. Calcineurin inhibitors are immunomodulators. They control inflammation and reduce the immune system response to allergens. Pimecrolimus is indicated for the treatment of mild to moderate atopic dermatitis. It is approved for short-term and intermittent long-term therapy. Tacrolimus is approved for the treatment of moderate to severe atopic dermatitis that has failed to respond to corticosteroid treatment. Pimecrolimus and tacrolimus are not effective in treating plaque psoriasis. Pimecrolimus and tacrolimus inhibit T cell activation and the production of cytokines, interleukins, and interferons that mediate the inflammatory response. Pharmacokinetic data on pimecrolimus is limited. Absorption through the skin is minimal, and cutaneous metabolism is negligible. Common adverse reactions associated with topical application are local burning and itching of the skin. So for the tacrolimus, we have the protopic ointment. For pimecrolimus, the brand name is Elidel, and it's only available as a cream. Calcitrol is an active form of vitamin D. Calcipotriene is a synthetic analog of vitamin D, and it is approved for the treatment of psoriasis. It inhibits the rapid and repeated production of new skin cells, proliferation. It inhibits the proliferation of T cells and inhibits the release of mediators of inflammation. The mechanism of action for topical calcitrol is unknown. So we have our vitamin D analogs. You can see for the calcipotriene and betamethasone dipropionate combination, we have foams, gels, ointments, and suspensions. The psoralins are a class of drugs that increase photosensitivity and are classified as furanocoumarins. Methylpsilin is the only drug in the class that is derived from a naturally occurring photoactive substance that is found in the seeds of the Amimagus plant. It is used for the treatment of atopic dermatitis and psoriasis, along with UV light therapy. Adverse reactions produced by oral methylpsilin therapy is photosensitivity. And that medication is available in a 10 mg capsule. Atopic dermatitis is believed to be an autoimmune disease. Therefore, immune system modulation and immunosuppressant can downregulate the body's response to allergens and other irritants. Cyclosporine and methotrexate are immunosuppressants used for the treatment of psoriasis. Both drugs are used to treat other conditions such as cancer, and methotrexate is also used to treat rheumatoid arthritis. Cyclosporine is FDA approved for the short-term treatment of severe atopic dermatitis and psoriasis. Methotrexate is an anti-metabolite that is indicated for the treatment of moderate to severe chronic psoriasis and psoriatic arthritis. Otezla is approved for moderate to severe plaque psoriasis. Cyclosporine selectively interferes with T cell proliferation and interleukin production. The result is a decreased immune system response. Methotrexate also interferes with normal DNA synthesis. Apremilast improves psoriasis and thickening skin by reducing the release of substances that produce an anti-inflammatory response. So we have this chart of immunosuppressants and immunomodulators. So we have cyclosporine, which we've talked about before, methotrexate, we have Humira, Enbrel, Remicade, Inflectra, Taltz, Cosentyx, Stelara, Otezla. So there's many different options. Retinoid analogs are used to treat psoriasis. Acitretin is a synthetic retinoid, and tazarotene is a retinoid prodrug. And then we have them here listed. So the acitretin Soratane is available as capsules. And then we have tazarotene, which is available as a cream, foam, and gel. The foam is Fabier Tazorac. So we have the summary of drugs used in the treatment of eczema and psoriasis. You can see for the first few that we've already talked about them, but they're all warning labels that should be applied, should be for external use only. Shake well for foams and lotions. For Elidel, you should avoid excessive exposure to sunlight. For Protopic, you should avoid grapefruit juice. It does have in parentheses though just the capsule of tacrolimus, assuming that's what it means. For Neurol, it should be taken with food, avoid pregnancy and alcohol. Methotrexate, we should avoid alcohol, prolonged exposure to sunlight, pregnancy. Exercise precautions for handling, preparing, and administering cytotoxic drugs. For vitamin D analogs, avoid excess exposure to sunlight, avoid face. For furanocoumarins, we're going to avoid sun exposure for 24 hours before and 48 hours after treatment. So that's a big thing to think about. For the immunomodulators, we have refrigerate, do not freeze for quite a few of them, protect from light for quite a few of them. For the infliximab, we need to gently swirl the reconstituted product. These medications like infliximab should not be shaken, and we want to discard any unused portion.